Medicare mistakes. It's a real thing. Wall Street Journal is bringing out 5 Medicare mistakes. This is Medicare mistake number 2. And I can tell you, after serving retirees for many years, mistakes are prevalent. And you know what? Don't blame yourself, because Medicare is very complex. Medicare is changing all the time. It's a brand new system for folks rolling into turning 65. And yet, as we roll down the road into retirement, Medicare continues to change. So let's take a look at Medicare mistake number 2. This is coming from the Wall Street Journal, as I said, the 5 biggest mistakes. Let's scroll on down to mistake number 2. And let's go ahead and blow that up a little bit there. And this is a big one. This is a big one where we, just to put this out here, understanding the costs of Medicare Advantage. Understand the costs of Medicare Advantage. Very popular. You're probably getting a lot of TV ads coming across, a lot of mail in their phone, even folks calling you on the phone about Medicare Advantage plans. And I'm going to read this. This is so important. I'm going to read this from the Wall Street Journal because I wanted you to get a hold of this. I believe in educating is going to help us learn. And when we learn, we tend to earn more in keeping our retirement savings protected and secure. Mistake number 2, ignoring costs can go the other way too. Some people will choose Medicare Advantage plans without really understanding the real price tag. Let's untangle a little more of the jargon. Medicare Advantage is an alternative to traditional Medicare. You must first sign up with Medicare Parts A and B, and then you sign up for a Medicare Advantage plan, often Part C. This is usually bundling A, B, and D, delivered by private companies that are approved by Medicare. Be careful, though. Some Medicare Advantage plans don't prescribe prescription drug plans, okay? But let's get into the meat here. Medicare Advantage companies often tout zero premium plans, and some offer out-of-pocket expenses, lowering the traditional Medicare and often zero. What's more, some plans cap out-of-pocket expenses at a total of $9,500 combined in and out of network. Okay. In addition, Medicare Advantage companies are paid a fixed amount of money each month by the government. So the companies have a strong incentive. I'm going to realize this here. The companies have a strong incentive to reduce their costs by providing more generous coverage for medicines that keep you out of the hospital. Okay. So, but some of these positives are slightly misleading. Zero premium applies to Part A and D, meaning you are still paying the Part B premium. However, these cost savings on an out-of-pocket expense only apply if you stay in network. If you go out of network, things can quickly become very expensive, likely having to pay 20% coinsurance on hospital stays. If your hospital stays cost $40,000, you're on the hook for $8,000. Now, I just want to make sure you remind yourself, check your max out-of-pocket fine print. Those change year over year over year. This is the time here in October, November to look at that, the max out-of-pocket. And it can be very deceiving, so make sure you understand that. If you do opt for Medicare Advantage, you will need to do some homework. The typical Medicare beneficiary has access to around 40 Medicare Advantage plans in the area. Now, that is not true here in the rural segments. In the rural segments, Medicare Advantage plans may not be available, or if they are available, there's going to be a handful of plans. Now, if you're in major metropolitan areas, the article is true that there will be lots of plans available. Okay, so don't be misled. If you're living out in the country like I do, I enjoy the countryside, like a small farm and all that. Make sure you understand exactly A, is there Medicare Advantage plans, B, and B, does that make sense, or does a Medigap Medicare supplement plan make more sense? Okay, so the HMO options are cheapest. In part because they charge when you're out of network for non-emergency care and want a referral for specialist care, followed by local PPO plans. If you're not traveling a lot and are happy with the doctors and hospitals in your HMO area, then you should not pay for a PPO plan. Now, this is very important because we may find more HMO plans popping up now than PPO plans. And so therein lies you're doing this balancing act, right? How much freedom to want to go where I want to go versus how much cost control. They're going to be cost controlling for me on an HMO. So what do I want to do? Okay. So these are things to look at. Again, this is the Wall Street Journal, August 15th here in 2023. Showing the fact that understand the cost of Medicare Advantage. There's an entire business behind the scenes that is going on that you must recognize to say, there's a lot of management stuff going on behind the scenes. How much do I want to be part of that, or do I want to control more of what I'm doing? Okay. So this is where I'm all about saying, hey, take the Medicare 101 challenge with me, spend 20 minutes on the phone. We go over Medicare 101, which is the Medicare Part A, Medicare Part B, D. We talk about what's going on to figure out, is there something affordable that gives you full freedom and allows you to put yourself more in the driver's seat moving forward in light of what's coming down the pike. So again, healthcare expenses are a big deal. We do need to take the time this season, this October, November, we need to take the season to explore the options that are coming at us and to find out, are we set for the future as we move forward with expenses? Because it is incredible. It is really incredible. So with that, it's always a joy to meet and chat with everybody. And we got educational streams happening. Yep, they're first 2 weeks of October. You can join them over on Facebook and YouTube, and make sure and share with your friends. There's going to be some information coming out along the way here. You get the feel of how I like to share information along the way, and I want you to make sure to have the most information that you can possibly have, given the limitations of what Medicare puts upon us in terms of communication. Let's see if we can get some understanding of what's going on and get you to plan and really save for the next year and moving forward. So with that, Mark Rogers signing off. Always good to see you. Let's not make any more mistakes.